Hello, my name is Jen, and today I'll be talking about acupuncture. Acupuncture is a form of Eastern medicine used to balance the qi of an individual to promote wellness and well being. Qi is said to flow through meridians or pathways in the human body. These meridians and energy flows are accessible through 350 different points in the body. Very, very small needles, 0.25 millimeters to be exact, are then inserted into these points with specific and appropriate combinations. These combinations bring the energy flow back into its proper place. When acupuncture is completed with massage therapy, proper diet, herbs, and heat therapy, the results are longer lasting physically, emotionally, and spiritually. In the past, acupuncture was primarily used to balance the energy flow of an individual to promote overall wellness. Today, it is used as a means of healing for conditions like osteoarthritis, low back pain, neck pain, knee pain, headaches, and even migraines. In recent times, studies are also being conducted to see if acupuncture helps some autoimmune diseases like fibromyalgia. Some say that acupuncture can also help neuralgia, petrus, Tourette's, and tobacco or alcohol addiction. It is also suggested to help some urinary tract infections and epidemic hemorrhagic fever. In an acupuncture session, the patients will have went through all necessary intake and consent forms, and then an assessment by the acupuncturist. The patient may lie on their back, front or side, depending on where the needles need to be inserted in the body. The needles are sterile, 0.25 millimeter, single use, and disposable. When a needle is inserted, there may be a brief stinging or tingling sensation. In some cases, the needles are heated or stimulated with electricity after insertion. The needles will typically remain in place for 5 to 30 minutes. Acupuncture is an effective treatment for people suffering from specific diseases, disorders, or conditions. A German randomized controlled trial showed that acupuncture is more effective than no acupuncture at all. Another German trial showed that 11 acupuncture treatments given within a 6-week period was as effective as a beta blocker taken daily over a 6-month period, with much fewer side effects, if any at all. The 2009 Cochrane Review by Lind and colleagues found that there is a consistent evidence that acupuncture is beneficial in the treatment of acute migraine attacks, and that acupuncture is as effective as a prophylactic drug treatment and has fewer adverse effects. These are just a few examples of research backing the effectiveness of acupuncture for migraines. Now let's take a look at how fibromyalgia is affected by acupuncture. 20 fibromyalgia patients received 12 weeks of acupuncture treatment at identical acupuncture points in the same sequence. At the end of the trial, 3 of the patients reported slight improvement, 10 patients reported moderate improvement, and 7 reported significant improvement overall. Although the study shows acupuncture being effective, many more studies are still needed and being conducted. Some other conditions that research has shown that acupuncture can be effective for is asthma, women's reproductive health issues, and gastrointestinal disorders. Acupuncture has shown effective in alleviating the symptoms of respiratory diseases, including asthma. It also helps to reduce the frequency and intensity of asthma attacks. In the case of gastrointestinal disorders, it is helpful in relieving some of the discomfort caused by chronic liver disease, IBS, GERD, and inflammatory bowel disease. Of course, with every good thing, there are those that disagree. Unfortunately for acupuncture, there's not a lot of hard evidence providing how effective it can be. The most common complaint is that acupuncture only gave limited lasting improvement. Some studies showed that acupuncture helped relieve symptoms for only a few months after treatment. The next downside is cost for treatment. A first-time visit to an acupuncturist can cost from $75 to $95. Routine visits can cost from $50 to $70 per visit. It is easy for this to become quite expensive if a treatment requires the patient to come in 2 to 3 times a week for 6 weeks, but much more affordable at a routine once a month. The final downside is that science is having a hard time proving just how effective acupuncture is due to the lack of research studies. However, acupuncture is a beneficial form of treatment and preventative medicine if it is incorporated into an overall wellness routine. Regular maintenance is of course required to have lasting effects in acupuncture, like just about anything else. It is by no means a one-time cure-all. Experts say that regular visits are important for preventative health as well. Proper eating habits are also part of an overall wellness plan. The body requires certain foods to help maintain specific energy levels, regulate your sleep, and to remain overall balanced and healthy. Exercise is another activity that should be a part of any wellness routine. Exercise promotes body functions we do not typically receive on a daily basis due to the nature of most careers today. When all 3 of these practices are combined, you can be sure you will feel more energetic, more focused, happy, and most importantly, healthy. Although the clinical trials do not show much concrete data, we can see from individuals from the US and on who have benefited immensely from acupuncture. The socio-demographic characteristics of acupuncture users show that of recent users, 65% were female. 47% had a college or higher education level. And the average age of the users was 41 to 64 years old. Another interesting fact was 90% of users were from a non-Hispanic origin. The findings also reflect that the increasing use of acupuncture among the American population indicates that more people are accepting acupuncture treatment for their health care. And it also shows that more people are looking for alternative ways of healing. With so many women turning to acupuncture, does that mean it is more effective for women specifically? The reason for this may be because acupuncture is an effective treatment for female reproductive health, leading more people, more women to choose it as a means of medical treatment. And finally, I would like to ask all of you to do something great for yourself and book an acupuncture session. Once you find an acupuncturist you like, go ahead and book a session. To find an acupuncturist you feel comfortable with, visit some different offices, ask questions, see how long they have been in practice, etc. As for prices, they can vary from place to place, but usually are around $75 to $95 for the first visit and $50 to $70 after that. Sessions typically last from 60 minutes to 90 minutes. And most importantly, the price should not be as important as the practitioner. You want to make sure you feel at ease in their clinic and with them poking you with needles. Your relaxation is key. Make an appointment today. You will not regret it.